The Division of Adolescent and Young Adult Medicine was established at Children's Hospital Los Angeles in 1963. The division aims to advance the health and well-being of adolescent and young adults by integrating healthcare, health promotion and disease prevention, positive youth development, professional education, advocacy, and research and evaluation.
In addition to providing primary and subspecialty healthcare to adolescents and young adults, specialized programs have evolved to address health and mental health needs of special populations, including youth at risk or living with HIV, transgender and gender non-conforming youth, youth experiencing homelessness, youth struggling with or at risk for substance use disorders, youth with chronic illness, expectant or parenting teens, and youth experiencing mental health disorders. The Leah team welcomes you to the 2021 Leah Grantee Meeting.
CHLA's Leah was funded for the first time in 2017. Faculty and trainees meet on Monday mornings for our educational curriculum composed of interactive learning modules, covering a comprehensive breadth of topics central to adolescent and young adult health. Fellows work on projects, meet with discipline supervisors, and participate in leadership skill-building activities. Last year, we added a segment called Hot Topics, where individual trainees put together a 15-minute presentation on a current topic in adolescent health. This edition was a wonderful way to get our trainees more involved and to provide them with teaching and leadership development opportunities. Every year, but this year in particular, we strive to center the principles of diversity, equity, and inclusion, and anti-racism into our curriculum.
On Monday afternoons, long-term trainees participate in the Leah Interdisciplinary Training Clinic. Fellows are divided into two interdisciplinary care teams. Preceptors from each discipline guide and support the teams. Before the start of the clinic, teams meet for a pre-clinic huddle, reviewing key aspects of the medical and psychological history of the youth scheduled for that day. Trainees take turns leading the huddle, and the team decides who will meet with the patient and in what order. During the clinic, team members communicate assessments and care plans with each other and with their preceptors.
During COVID, the program shifted to providing some visits via telehealth. This created new opportunities and challenges for the trainees, preceptors, and patients. Our training program seeks to fulfill the diverse learning needs and highlight the strengths of all disciplines. We model flattening the medical hierarchy in order to allow for collaboration, information sharing, and shared decision making. We also teach how meaningful interdisciplinary collaboration is related to social justice.
Several of our Leah group projects have led to meaningful system change. One example is focused on Medi-Cal funding for minor consent services. In California, minors have the right to consent to a number of funded sensitive services without parental knowledge or consent, but the program is not well publicized, and there are significant barriers that limit access. In year one of the grant, Leah Fellows went to a local public social services office to get a sense of what a young person applying to the minor consent Medi-Cal program would experience. They learned that the staff were unfamiliar with the program and unable to provide accurate information about eligibility and the application processes. With this knowledge, the trainees traveled to Sacramento and advocated for changes in Department of Health Services practices in order to make the minor consent Medi-Cal more accessible for young people. Their advocacy resulted in procedural changes that were instituted the following year and are continuing to make the program more accessible.
To address the history of racism and historically elevated white privilege in healthcare, we made sure diversity, inclusion, and equity are part of our didactic activities and lectures. This year, we added an anti-racism project to our curriculum. Trainees work in discipline-specific groups to identify how racism has historically been manifested within their areas of expertise, as well as review the efforts their professions have taken to address this history. Fellows shared their findings with their peers and with Leah faculty. Projects like these deepen fellows and faculty understanding of how racism both historically and currently manifests in our respective fields and of tools they can apply to combat racism in the healthcare services.
Each year, the CHLA Leah program sponsors a conference for community professionals on a theme germane to adolescent and young adult health. The conferences have created a unique opportunity to bring together a diverse group of professionals from a variety of professional disciplines with the shared goal of improving services to adolescents and young adults in our community. Conference topics so far have included cannabis use, providing gender-affirming care, and creating safer and supportive service environments for young people. In 2021, we will tackle the broad topic of body positivity in adolescence, centering the experiences of BIPOC youth and the complex intersections that affect their ability to pursue health and wellness. As our 2021 conference will be virtual, we have the opportunity to expand our audience nationally and will include our Leah partners among our guests.
Well, we hope this little video made by Maya and Gabe,
Hi.
two young adults living in our community, gave you a sense of who we are and what we value at our CHLA Leah. Welcome everybody.